Breast cancer is one of the most prevalent cancers affecting women worldwide, with millions of cases diagnosed each year. While certain risk factors like age, genetics, and family history cannot be changed, there are proactive steps individuals can take to lower their risk of developing breast cancer. In this guide, we will explore evidence-based strategies recommended by healthcare professionals to reduce the risk of breast cancer. Understanding risk factors. Age. While age is a non-modifiable risk factor, being aware of the increased risk associated with advancing age underscores the importance of early detection and proactive lifestyle measures. Women over the age of 50 should prioritize regular breast cancer screening as recommended by their healthcare providers. Genetics. Understanding the role of genetic mutations such as BRCA1 and BRCA2 in increasing breast cancer risk can empower individuals to make informed decisions about genetic testing and risk-reducing strategies. For women with a family history of breast cancer or known genetic mutations, options such as enhanced surveillance, risk-reducing surgeries, or chemoprevention may be considered in consultation with a genetic counselor or healthcare provider. Family history. Recognizing the impact of family history on breast cancer risk highlights the importance of gathering and sharing relevant family health information with healthcare providers. Those with close relatives diagnosed with breast cancer may benefit from earlier or more frequent screening, as well as lifestyle modifications aimed at reducing overall risk. Lifestyle factors. While lifestyle factors such as diet, physical activity, and alcohol consumption are modifiable, their influence on breast cancer risk underscores the importance of adopting healthy habits. By making informed choices such as maintaining a healthy weight, following a balanced diet, engaging in regular exercise, and limiting alcohol intake, individuals can mitigate some of the risk associated with these lifestyle factors. Hormone replacement therapy, HRT. Understanding the potential link between hormone replacement therapy and increased breast cancer risk allows women to weigh the benefits and risks of HRT when considering treatment options for menopausal symptoms. Alternative approaches for managing menopause, such as non-hormonal medications or lifestyle modifications, may be recommended for those concerned about breast cancer risk. Environmental exposures. While the exact impact of environmental factors on breast cancer risk is still being studied, awareness of potential exposures to chemicals, pollutants, and endocrine-disrupting compounds can inform efforts to minimize environmental risks. This may include advocating for policies that promote environmental regulation and adopting personal practices such as reducing exposure to harmful chemicals in household products and cosmetics. Maintain a healthy weight. Maintaining a healthy weight is a crucial component of reducing the risk of breast cancer. Here's a detailed exploration of how weight management can contribute to breast cancer prevention. Understanding the link. Excess body weight, particularly obesity, is associated with an increased risk of postmenopausal breast cancer. Adipose tissue, or fat cells, produce estrogen, and higher levels of estrogen can fuel the growth of hormone receptor-positive breast cancers. Additionally, obesity is linked to chronic inflammation and insulin resistance, which may promote the development of cancerous cells. Healthy weight guidelines. Aim to achieve and maintain a body mass index, BMI, within the healthy range, typically between 18.5 and 24.9. However, it's important to note that BMI is not always a perfect measure of health, and factors such as muscle mass and distribution of fat can influence individual risk. Consult with a healthcare provider to determine a healthy weight goal that is appropriate for your body type and health status. Balanced diet. Adopting a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support weight management efforts. Focus on consuming nutrient-dense foods that provide essential vitamins, minerals, and antioxidants while minimizing empty calories from processed foods, sugary snacks, and excessive fats. Portion control. Pay attention to portion sizes and practice mindful eating to avoid overeating. Eating smaller, more frequent meals throughout the day can help regulate hunger and prevent excessive calorie intake. Regular physical activity. Incorporating regular physical activity into your routine is essential for achieving and maintaining a healthy weight. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week, as recommended by guidelines from organizations such as the American Cancer Society. Activities such as brisk walking, jogging, cycling, swimming, or dancing can help burn calories and improve overall fitness levels. Strength training. In addition to aerobic exercise, incorporate strength training exercises into your workout regimen to build muscle mass and boost metabolism. Muscle tissue burns more calories at rest than fat tissue, making strength training an effective strategy for weight management. Lifestyle modifications. Make sustainable lifestyle changes to support long-term weight management goals. This may include setting realistic objectives, keeping a food diary to track eating habits, seeking support from friends or a healthcare professional, and finding enjoyable forms of physical activity. Monitor progress. Regularly monitor your weight and track changes over time to assess progress towards your goals. Celebrate successes and make adjustments as needed to stay on track with your weight management plan. Adopt a healthy diet. Emphasize a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit consumption of processed foods, red meats, and sugary beverages. Incorporate foods high in antioxidants and phytochemicals, such as berries, nuts, and leafy greens. Limit alcohol intake. Alcohol consumption is linked to an elevated risk of breast cancer. Limit intake to no more than 1 drink per day, if consumed at all. Be physically active. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Incorporate activities such as walking, jogging, swimming, or cycling into your routine. Breastfeeding. Breastfeeding may reduce the risk of breast cancer, particularly if done for a longer duration. Hormone replacement therapy, HRT. Discuss the risks and benefits of hormone replacement therapy with your healthcare provider if considering it for menopausal symptoms. HRT may increase the risk of breast cancer in some women. Regular screening and early detection. Follow recommended guidelines for breast cancer screening, including mammograms and clinical breast exams. Early detection through screening can lead to more successful treatment outcomes. Consider chemo prevention. For women at high risk of breast cancer, certain medications, such as selective estrogen receptor modulators, SERMs, or aromatase inhibitors, may be recommended for chemo prevention. Discuss the risks and benefits with your healthcare provider. While it's not possible to completely eliminate the risk of breast cancer, adopting a healthy lifestyle and being proactive about screening and early detection can significantly lower your chances of developing the disease. By incorporating these evidence-based strategies into your daily life and staying informed about your individual risk factors, you can take control of your breast health and reduce your risk of breast cancer. Remember to consult with your healthcare provider for personalized guidance and recommendations based on your unique situation.